For years, we've heard stories about Canadians getting in their cars and driving across the border to receive faster healthcare. We've also certainly heard about a lot of Canadians flying to different destinations in the United States. But it seems like more and more we're hearing of Canadians actually traveling further afield. Today, we're going to chat with a patient from Alberta who traveled to Mexico for treatment. We're going to talk to a surgeon who operates a clinic all the way over in Europe, in Lithuania, about treating Canadian patients. So today we're going to start off with Tracy Skinner. She's a patient from Alberta. Tracy, thank you for taking a few minutes to chat with us today about your experience.
Yeah, no problem.
Uh, let's start off, Tracy. If you could give us sort of the big picture, what was it that led you to have to go to Mexico for treatment? What was the health condition that you were struggling with?
Well, I suffered from herniated discs in my lower spine. And I had, well, first of all, was the wait times to get in. And I was put in an emergency situation where I was put in the hospital for the first week of December. But I still didn't get my surgery till February. I was having issues going to the bathroom. Like I had no mobility. I had 3 herniated discs. But I had been on this waiting list for such a long time. So they did the first surgery. It was unsuccessful. And that was in 2005. They did the surgery in February. And so for the next kind of 15 years, I struggled tremendously with pain. Our system was unwilling to do anything else for me because they'd already treated me. So it was basically, I was now the patient of injections and therapies. I had exhausted all treatments that you can think of here in Alberta, including to see a psychiatrist to see if the pain was all in my head. I accidentally stumbled upon Baja Med in Mexico, and they informed me that they could help me and right away. And so actually my mom was suffering from very similar things. So my mom and we went over there in January of 2018, and both of us had very similar surgeries, which were hugely successful, life-changing. And, to the point that, go ahead.
The state had basically thrown up its hands with your situation, said, well, we've done everything we can, right? What was
That's correct,
what were you going through on a daily basis?
On a daily basis was incredible pain. My left leg was pretty much useless. It had lost an extreme amount of muscle. I dragged around my left leg for 5 years until I found a physiotherapist that could help me with that. The inability to sleep, the constant chronic pain. I can't take pharmaceuticals. They don't react well with me, and it's not a solution anyways. It's just a Band-Aid. But, I did all the therapies that you can, the laser, the acupuncture, the injections they kept sending me for. Nobody could help me. I even inquired with the private clinic, the Cambie Clinic over in Vancouver there, and they wouldn't touch me because I had a previous surgery already. And also I'd like to note that it seems to me, in my opinion, and for the people that I've sent to Mexico, their medical system there is far more advanced. The surgeries are far more advanced, and they do very different surgeries than what they do here in Canada. Right now I have 2 implants in my spine called the Gel Fix implant. And I live a pain-free life. I have my full mobility back. I'm sleeping at night. It has tremendously changed my life and given me my life back after 15 years of struggling here in Canada.
We've only got about 30 seconds before the break, but how did you find this clinic in Mexico?
It was, as I said, it was kind of a fluke. It was kind of through a friend. She had gastric bypass surgery there. And being that I had very little mobility, and to the previous years, I was very, very fit, and that we were kind of going to go for these mommy makeovers. She needed some work done from her surgery. And they inquired, if I'd had previous surgery, and I mentioned the back surgery, and they asked how that was going for me. and then
Mm.
basically inform me that they could help with all the issues that I was having.
Well, now we've got to take a commercial break, but when we come back, we'll talk a little bit more about your experience going abroad for surgery.
Okay.